People make decisions all the time. Many are simple and many involve multiple choices with multiple possible outcomes. Even though we're used to making decisions, deciding on medical tests and treatments are some of the most stressful decisions we'll have to make. But they're usually no more complex than other decisions, providing we get the right information. And the good thing is, your doctor will share the decision making with you.
Now, Renee, how can I help you today?
Ask more and share more in order to know more. Making good decisions is a combination of your health professional's expert knowledge of medicine and your individual lifestyle, preferences and needs. So it's really important for you and your doctor to make the decision together. If, for example, you're deciding on which contraceptive method to use, your choice will be influenced by a range of factors, including any medical conditions you may have and any plans to have children in the future. To make an informed decision about which treatment option is right for you, ask your doctor these 3 questions. What are my treatment options? And one of these options will always be to wait and watch. What are the possible benefits and harms of those options? How likely are each of those benefits and harms to occur to me?
So I'm on the pill right now and I'm just wondering about my different options for contraception.
See, there are lots of different options for contraception. There are lots of different types of pills, but there are also other forms of contraception that you might want to consider as well. And they've all got pros and cons, advantages and disadvantages. So it's a matter of working out what's going to be the best sort of contraception for you.
So what are the harms associated with each of those options?
That's a good question, Renee. So we know for women that are taking the combined pill containing estrogen, we know that there can be a small risk of blood clot. There's some risks associated with the other forms of contraception as well. So, for instance, with an IUD, there's a small risk of damaging the walls of the uterus when we put in the IUD. So it's a matter of balancing those risks and those benefits as well.
And how likely are each of those benefits and harms to happen to me?
The pill is very low. It's the same as the background risk for all the women who are taking the pill, and it would be something of the order of 6 or 7 women out of every 10,000 women in a year would experience a blood clot.
Right. And how about for the implant?
So we can't predict what's going to happen to you, but what I can say is 1 in 5 women who can have what we describe as sometimes troublesome bleeding or prolonged bleeding, heavy bleeding. But of course that's 1 in 5 women, whereas 4 out of every 5 women will actually have an acceptable bleeding pattern.
Asking the right questions means you will receive care that better meets your needs. So making the right treatment choice means understanding your treatment options and sharing the decision making with your doctor about which option best suits you. The more information you share about you, the easier it will be for your health professional to give you the information you need.
So it's important for me to find out more about you. I know that you're not a smoker and you're not overweight, and we found out that you haven't got a family history of blood clots. So your risk of blood clots if you were to use the pill is very low.
Is there an option that fits with your lifestyle, preferences and needs best? You are the best judge of whether you'll take a tablet every day. So if you won't, it's best to tell your doctor at the time so you can discuss other options.
So Renee, you've got a lot of information now about the different contraceptive methods. Have you had a chance to think about which one you think would be suitable for you?
Yeah, well, based on what I've heard, I do like the idea of the IUD for not having to take a pill every day.
Once you have the information from your doctor and have considered how you feel about the options, you can make the decision that is right for you. Ask more and share more in order to know more.